Comments Matters. I'm your host, Carol Love, and this week, as I've been saying, we're talking about the issue dealing with the healthcare system. And today's video is going to be coming from the Wall Street Journal. And this video was titled Medicaid Explained: What's Trump Cutting in 2025? So what he did back in 2025 is affecting us today in 2026. So we got some great commenters here. Check out the name. You might just be here, and your comments is going to be on the show today. We got Jake, we got Norm, we got Carter, and we got Theogen. We got these commenters that's going to be commenting on the show today. So let's take a listen to the video and see what is going on with the healthcare system.
Medicaid is huge. It covers nearly a quarter of Americans and costs more than $800 billion. Huge. But this chart is total spending. Here's what the federal government's share has been. And it's projected to grow even more in the next decade. But the Republicans' big beautiful bill is estimated to cut the spending to here, largely by lowering the number of people covered. Medicaid really started small. So how did it get so big? And who's going to be affected? A quick history lesson. In 1942, Congress gave President FDR the power to freeze wages to fight inflation, which he did. So in order to compete for employees, businesses offered benefits, like this new thing called health insurance, which only 9% of Americans had. The IRS then said that employees didn't have to pay taxes on their insurance premiums, and the Supreme Court ruled that unions could bargain for insurance. By 1950, more than half of Americans had private health insurance. This is what set up the U.S. as one of the only developed countries without some form of universal coverage. And because the system ties coverage to a job and those old enough to be working, it creates gaps of people who are uninsured.
There's a buildup of tension over who's left out. And suddenly we end up with a new system that doesn't cover everyone, but adds the elderly and adds people in poverty.
He's talking about Medicare, which was created for anyone older than 65, regardless of income, and Medicaid, created at the same time, but at first only for those already on state welfare.
It was an afterthought. It was not seen as a program that was designed to survive and grow.
And while Medicare is funded through payroll taxes, just like Social Security, Medicaid is federal assistance to states running their own programs.
The funding logic of Medicaid has made it both contentious, unstable, but also explains its expansion. Every state was able to sign on and to negotiate issues like coverage. That flexibility also allowed states to, in some ways, tailor the system to their population. As people often say, if you've seen one Medicaid program, you've seen one Medicaid program.
Over the years, as states would expand their eligibility, Congress would often follow suit, eventually covering the disabled, infants and pregnant women in poverty, children in poverty, eventually children not in poverty, and even single working adults with lower incomes under the Affordable Care Act.
These were incremental changes to try to leverage the program to help fill in the gaps for individuals that had no other access to insurance coverage.
At any given moment, you have people saying, I know, let's just change eligibility because people need coverage.
So now this is what healthcare coverage looks like in real numbers in the U.S. Most working age adults still get their insurance through their employer, some through public programs like those in the military. Many who make just over the poverty line or are disabled are on Medicaid, as are a lot of children, even if their parents don't qualify. Nearly everyone 65 and older has Medicare, and most also have an additional type of coverage. Many people buy health insurance directly on their own. Most use the healthcare.gov marketplace created by the Affordable Care Act for those that make too much for Medicaid but can't access or afford employer coverage. Nearly all of them receive tax credits to make it affordable.
I think it's fair to say it's all patchwork.
In the last few years, we've had record low numbers of people without health insurance.
Again, senior citizens, pay attention. Listen to this data. Listen to this information. It affects us. And if you're not a senior citizen yet, keep living. This is going to matter to you.
Uninsured because of work requirements and administrative barriers.
Imposing work requirements doesn't actually lead to additional employment, but does create these barriers to for people being able to maintain their coverage, so more individuals wind up without health insurance coverage.
And because the tax credits for the marketplace are not being extended, an estimated 4.2 million could lose coverage because it would simply cost too much. And losing that coverage doesn't mean they can just join their employer plan. Less than half of those with low incomes have access to insurance through their jobs. Even fewer part-time workers.
There just aren't a lot of other options.
Medicaid has grown so large because it patches the gaps of those left out of this employer coverage-based system. But now, for the first time, that gap is going to widen.
All right, everyone, you saw the video right here. You probably seen it before, and your comments matter. Make them known right here on our show here today. So as you can see, look at the difference between Medicaid and Medicare. Who's covered, who's not covered, and there's a gap. What happens with those people that's in that gap? How do they get their coverage? And like she was saying, that 8.7 million people are going to be losing some form of their health care coverage. What are these people going to do? You know, I just had a friend the other day I was talking to, and they were paying for her insurance. It was like $500 a month. Now she has to pay $1,700 a month. And she said, no way, she'll go without the insurance. Wow. See the gap? See what happened when people can't afford this high coverage that's going on now, when you don't even have a plan in place to help these people to assist in this high cost of health care coverage. It's just unbelievable how much it costs to stay alive. Okay, then they want to get us when we die. You got Colonial Penn, them. They're talking about your life insurance. You can't even afford health insurance. How are we going to afford life insurance too? It's just a mess, just a mess. All right, everyone, you saw the video. Let's get into the comments and let's see if you agree with some of our commenters. Okay, let's take a look. Here we go. All right, our first comment is coming from Jake, and Jake says, Medicare and Medicaid need to be allowed to negotiate with pharmaceutical companies. We pay 10 times more for the same medications we sell in other countries. Jake got 15 likes on that comment. What about you? Do you agree with Jake's comment? Take a look at Norm Hagan. Norm says, either we adopt universal health care and ditch the current system, or demand that all employers cover their employees. He got 100 likes on that comment. Do you agree with that comment? We got some great ones here on today. Take a look at Carter. Carter says, I'll answer your question. It's because there's a lot of poor people in this country with terrible jobs that don't pay living wages. Those are the ones that's caught in that gap, isn't it? Good comment, Carter. I can see your point on that. Carter got 36 likes on that comment. What do? And look at more people losing their jobs, losing their homes, losing their cars. So what are you going to do for health care coverage when you don't even have a home and a job to care for yourself? What you going to do? Who's going to pick up the tab when you get sick and you have to go to the hospital? Who's going to pick up that ambulance bill that's going to cost you between $7,000 and $10,000? Who's going to pick it up? See, this is how the cost just gets out of hand. Take a look at our last comment. Our last commenter is the agent of death. Oh my goodness. The agent of death says, isn't it well known in America that most employers only schedule you for 38 hours a week, so you won't be considered full-time and thus don't have to give benefits like health care? I don't know. It's almost as if you created a system where it incentivized companies to only hire part-time employees. Now, the agent of death, you got a good comment right there. You making some sense. That's pretty much it is, isn't it? When you look at a lot of these stores, like Walmart, Dollar Tree now, these retail stores, they only want you to work part-time. So they don't have to pay you health care. Don't have to give you all the benefits as a full-time employee would have. This is a dire situation that a lot of families find themselves in. See, I'm a senior citizen now, and when I was young, my husband, he's deceased now, but when he was alive, my husband was a welder, and thank God he was in a union, and in that union we had the best benefits, and we didn't have to pay for anything. We had 3 children, and all my children birth was free. I didn't have to pay for nothing. Never had a bill. Never had a bill, because my husband had a great job. He had a great union, and they had great benefits, and I like that. But what you said, Norm said earlier, our second commenter, he said, either we adopt universal health care and ditch the current system, or demand that all employers cover their employees. Don't you want to cover your employees? Don't you want your employee to have a healthcare system so they can be healthy to come to work for you, to make you even more money? Employer, you want a healthy employee. Well, we need health care. All right, everyone. Hey, listen, that's going to do it for our commenters today. Do you agree with these comments? If not, make your comment known here below on the show that we provided here for you today. All right. So, hey, that's going to do it. Again, I'm going to see you on the next video. Thanks for watching, liking, sharing, commenting, and subscribing to Your Comments Matter. I'm Carol Love. See you on the next video.